Hi, my name is Jackie Short, and I'd like to welcome you to our podcast and interview series, What is Creative Therapy? Today, our guest is Dr. Robert Grant. Dr. Grant is a licensed professional and national certified counsellor, a registered play therapist supervisor, and a certified autism specialist. He completed his education from Missouri State University, receiving a bachelor's in psychology and a master's degree in counselling. Dr. Grant further received his doctorate in education from the University of Missouri-Columbia. He is a member of the American Counseling Association and Association for Play Therapy. Dr. Grant owns and operates the Robert Jason Grant Aut Play Therapy Clinic, where he specialises in play therapy techniques with children, adolescents, adults and families. Dr. Grant also specialises in working with autism spectrum disorder, neurodevelopmental disorders and developmental disabilities, and is the creator of Aut Play Therapy, an autism treatment using play therapy, behavioural therapy, and relationship development approaches. Dr. Grant has authored several publications, book chapters and articles, and has written 5 books on the subjects of play therapy, autism, and ADHD, including the best-selling Aut Play Therapy Handbook. Dr. Grant conducts various presentations and workshops on topics such as play therapy and autism, and has conducted these trainings and workshops throughout the United States and internationally. We're pleased and excited that Robert Grant can present a webinar for us on autism and play therapy shortly. And today would welcome Dr. Grant. So welcome, Robert. It's lovely to have you here today.
Thank you. It's good to be here.
I know you've got a background in psychology and counselling and play therapy. Can you tell us a little bit about how you started as a play therapist?
Definitely. It was many years ago now, but I graduated out of my counseling program and decided I would do a little part-time private practice. So I went into this private practice that a friend of mine had, and my first 2 clients were 2 brothers, 2 young siblings, and I realized pretty quickly that I didn't know what I thought I knew about working with young kids. So that is really what led me to play therapy. Almost all my clients early on were children, and so I started exploring really treatment options, theories, and I came across play therapy. It was not something that was talked about much in my counseling program at the time. So it was sort of new concept to me, but I thought this looks like something that would help me a lot. So I started going to some trainings, got some books. I think one of my first books was a foundations book that was edited by Charlie Schaefer, one of the co-founders of the Association for Play Therapy. And so I was just hooked from there. It was just more books, more trainings, then pursuing my registered play therapist credential and obtaining that, and just expanding my knowledge of play therapy ever since day one. I have not stopped reading, learning, pursuing trainings, lifelong learner in play therapy, I think. And I couldn't have ventured onto or found anything better. I can't even imagine folks working with children and not having a knowledge of play therapy and utilizing play therapy. I don't know what they're doing. I have no idea, because I can't imagine it, because I've been there. I've been there when I was trying to work with kids and I did not have that play therapy knowledge, and how much more ineffective it was.
Yeah, for sure.
Yeah.
What swung you towards focusing on children with autism?
Well, I was actually well along in my play therapy practice at that point when I got my first child referral who had autism, and he happened to be a little boy who was pretty severely impaired, autism diagnosis along with a chromosome disorder and intellectual developmental disorder. So, and there were some physical, other medical issues going on as well. So very complicated client. And I always joke, and I say this, and people who've heard me before will be like, we've heard that before, but it's the truth. If I had had better phone intake skills at the time, I probably wouldn't have taken him as a client. But it changed everything when I did take him as a client. And he came in, and it was kind of one of those moments like I just shared where I pursued play therapy. I quickly realized I don't have the tools to work with him really effectively. And so I did the same thing again. I'm going to go see what I can find that I can learn so I can work with him and his family and other kids who have autism. And then that just kind of exploded, much the same way as my pursuit of becoming a registered play therapist did. I just started going to more and more trainings and learning more. I loved it. I loved working with these kids and families. Once the slightest little word got out that I would work with a child with autism, I was flooded with referrals because there is such a huge need for this and for resources, and especially at that time for mental health professionals to work with these kids and individuals, because that wasn't happening very much. So I think I either found my calling or it found me, however you want to look at it, but it's a fit. I feel like that is probably the population that I connect with the most, I feel the most passionate about, even though I do still work with kids and families with other issues and some adult clients. That's definitely my heart is there in autism and neurodevelopmental disorders. So I keep learning about that too, always going to new trainings, always learning new things, always developing my own protocols and my own trainings more, and couldn't be happier doing it. I plan to do it the rest of my life. So it's good that I'm here talking about this, I guess.
A great commitment.
Yeah.
Yeah, thank you. Have you experienced any particular challenges? I guess you've spoken about the challenge initially of working with children and then the first client with autism that you had, but in terms of play therapy practice, have there been particular challenges or setbacks for you?
You know, I have not had many challenges or setbacks. I think once I started pursuing play therapy, it just really grew and grew. The practice grew, my knowledge grew, the opportunities grew. You know, when I started, I certainly wasn't doing trainings or writing books or any of that. That all came along sort of organically. At certain moments, it felt like, hey, I think I need to start training people in this now. Okay, now I think I need to write a book about this. And it all sort of happened as it needed to. So it's been a nice progression. I would say the challenge, probably one of the biggest challenge that I certainly see and I think I hear echoed by other play therapists, is just helping others outside of play therapy understand what play therapy is. It seems like there's a lot of misinformation, or people who think they know but they don't really know, or even people who just haven't heard of it, so they don't think it's something valid. So just whether that be other professionals or parents, just getting that word out there and educating about what play therapy really is and how it works, I think has been one of the biggest challenges, and I think it is still like a large challenge.
What would be your definition of therapy to the uninitiated?
Oh, I'm glad you asked me that, because I think that I explain it really well. But I don't know if I'll go into all that detail right here, right now. But briefly, I would say that play therapy is a process of therapy that is based in existing psychology and counseling theory. And those theories have been adapted to meet the developmental needs and levels of children, because children will do therapy differently than adults. And so that's what play therapy is. So everything is purposeful and based in existing psychological theory. So it's not necessarily, it's not frivolous. We may have fun and we may use toys, play, props, all of which are engaging to children. And of course, we know play is the natural language of children, but there is a point and a purpose behind it. And that point and purpose is grounded in counseling theory.
Yeah, fantastic. That is a good story.
Yeah, thanks.
In the work that you've been doing and the work that you continue to do, what do you think have been your greatest wins?
My greatest wins? I would say writing the Alt Play Therapy book. Getting that was my first book, and getting that first book sort of done and sort of off my shoulders was really a big win for me personally. And then I think putting together the certification program, that really put these tools of working with kids with autism using play therapy in the hands of people across the world. And that was so huge, and still is huge to me, and is still very fulfilling. And it's so fun when I run across someone, whether it's in person somewhere or through an email, and they've taken an alt play training and they're doing this in their community, and they're seeing all these kids with autism, and they're telling me about how they become the autism expert in their community. Like, this is great. I mean, this is probably something that I couldn't have even imagined it looking like that when I first started putting it together. So those are big wins for me sort of professionally. But I mean, in our profession, this is true for me, and I think this would be echoed by all of us. You know, the real wins are just in that moment with a family, when you see this change and you see this gain and you see this growth. And I love those times. And I do this when I do periodic evaluations. I'm sitting with a parent and I'm going through and I'm pointing out all these things that were happening or not happening when I first met them that don't exist now, you know, that have changed, the growth that has taken place. And that moment that we're sharing, because we're laughing about it because it was so much worse than it is now. And then we're like celebrating because it's so much better. That's just such a nice, special moment in therapy. And those are always the best wins.
Yeah, that's wonderful.
Yeah.
You mentioned one of the first texts that you had was one of Schaefer's books. Have there been particular mentors for you in the field of play therapy that still inspire you?
Well, for sure, my main mentor has been Charlie Schaefer. I mean, I really think that like he's lived the play therapy life that I would want to live. I just understand his writings and his brain so much. I just connect to his thoughts, and you know, I think I've probably read most of his books that I could get my hands on, because I do feel like play therapy for me is ultimately prescriptive. I value all the models, I value all the theories, and I want to know all of them, and I think they're all useful and beneficial. And so really share that thought with him, and just his pursuit continually of expanding, even now, play therapy. I just love that. And I think he's a great role model. Other people that have inspired me along the way, I shouldn't even start a list, because I'll forget somebody and then I'll feel bad. And I'll be like, you got to edit this, Jack. You got to add this name in there.
Sure, that's fine. We'll take it on board that you've been inspired by me.
Yes.
So that's
yes, that's right.
For those people who are maybe already working with play therapy, or working with children, or working with children with autism, is there any advice you'd give those people on the strength of your experience?
Yeah, I think in play therapy in general, just learn as much as you can, and trust the theories and the models. We've got so many good ones and they do work, they're effective, and just put yourself in that place of gaining that knowledge and getting that experience, and it's going to go well for you. With autism in particular, I would say the first step is learning everything you can about autism. So even before you start looking at alt play therapy or any other kind of treatment that you want to do, invest in understanding the diagnosis, because it's very complicated and there's a lot to learn there. But the best treatment approach for autism starts with just a thorough knowledge of the diagnosis and the disorder and how it affects children and adults and families.
Great advice. Thanks.
Yeah.
And is there a final pearl of wisdom you'd like to
Oh, I'm so bad at final pearls of wisdom. I can't even say it. That's how bad I am at it. I guess my final pearl of wisdom would be participate in this webinar training, because not just me, but the other people, that are going to be presenting, there's a lot to be learned from there, and that's an awesome opportunity. So any chance you have to hear somebody to learn more, that's the best thing you can do.
Yeah. I think that commitment to lifelong learning for all of us is a wonderful thing, and particularly in our personal growth and development, where we get better and better at what we do if we can keep learning and supporting each other along the way. So thank you
right.
for your time today, and thank you in advance for the webinar you're going to be running for us. We're really looking forward to it.
Absolutely. I'm excited about it.
Excellent. Thanks, Robert.
All right. Thank you.